They are the bus drivers and subway workers, the people that keep millions of New Yorkers moving from point A to point B. More than 2,000 New York transit workers have tested positive for coronavirus, and more than 50 have died from it. Like Ernesto Hernandez, a 58-year-old bus driver. His son said his dad's life was about work, church, and family. Caridad Santiago, who worked the night shift as a subway station cleaner in the Bronx, who leaves behind 3 kids and a husband. And Warren Tucker, known to his colleagues and friends as Big Tuck. He was a bus mechanic at the Central Maintenance Facility in Brooklyn.
In a place like New York City, transit workers are first responders. This city would not be able to respond to this crisis without our workforce. And they are out there every day, putting themselves in harm's way, exposing themselves to the public, and we've paid a heavy price for it.
Being a transit worker is very hazardous. Many times their lungs are exposed to diesel fuel or steel dust from these underground train tracks. And over a quarter of the workers are over 55 years old and have some sort of pre-existing medical condition. Add it all up, and they are extremely susceptible to COVID-19. The Metropolitan Transit Authority, or MTA, that runs New York's buses, subways, and commuter trains, ramped up efforts to sanitize everything, sometimes as much as twice a day, to make it safer.
Please exit through the rear door.
Hundreds of thousands of masks and millions of gloves have been distributed to help keep workers healthy. And there's a new campaign called Heroes Moving Heroes to bring attention to all they do under the most difficult circumstances. Keeping a city moving in times of a pandemic, even if it means risking their own health and maybe even life. Gabriel Elizondo, Al Jazeera, New York.